Print, email, Facebook, Twitter. More pregnant women at risk of domestic violence to get more support through Family Safety Hub. So far today, police in Australia would have dealt with on average 74 domestic violence matters. Learn more about these numbers. Share. Being pregnant can be stressful at the best of times, but for some women it can be downright dangerous, as the risk of violence is greater during pregnancy and postpartum. According to analysis of Australian Bureau of Statistics data, nationally more than half of women who have experienced violence at the hands of their former partner did so while they were pregnant. That is why expectant mothers and new parents will be the first group of people targeted for early intervention, coordinated by the ACT's new Family Safety Hub. The Safety Hub will not be a physical shopfront, but instead will bring together community organisations and government through existing networks of so-called trusted persons. They could be doctors, nurses and midwives who typically have contact with pregnant women, but also hairdressers, and online forums will be linked into pilot projects, with the first changes trialled within weeks. As part of establishing the hub, research uncovered harrowing stories of pregnant women in Canberra, including being beaten daily and a new mother who was denied food by her partner, which prevented her from breastfeeding. The commitment to set up a family safety hub was first announced in 2016, along with the country's first domestic violence levy. The move followed a cluster of deaths in the act, including 2 women who had recently given birth, Tara Costigan and Sabak Al-Mwali. An ABC investigation earlier this year revealed the steps Ms. Costigan took to get help from a midwife, a social worker and police, with questions raised about the advice she received. Research for the ACT's new hub confirmed early warning signs were not always noticed by trusted people. And if they were noticed, those people often did not always know what to do. How will the Family Safety Hub work? The aim of the hub has always been to better connect services in order to respond to family violence, but it is easier to begin to describe it by what it is not. It's not a new shiny door, Minister for the Prevention of Domestic and Family Violence Yvette Berry said. It's a different approach, an innovative approach, doing things in a way that we've never even thought about before and thinking outside more than just supporting services. The hub's research showed a new shopfront was not going to reach the most vulnerable people, who were more likely to disclose their abuse to a trusted person already in their life. The hub will instead come up with pilot projects to be run by existing support services and begin with one challenge, in this case early intervention for pregnant women and new parents. Legal Aid ACT's family violence team leader Margie Rowe said new innovative ways were needed to reach victims. I think it is much easier for women to, for example, see a lawyer in a hospital as part of their antenatal clinic, or see a lawyer in a community health centre where it is less intimidating and less threatening, she said. The projects will be closely tracked, and if they show positive results within 100 days they will continue, but otherwise they will be scrapped. Will this actually save lives and make women safer? We absolutely think this work could save lives, ACT Coordinator General for Family Safety Joe Wood said. That's why we're taking a really evidence-based approach to make sure the things that we're testing actually work, because that's the best way to offer safety. Ms. Berry also has high hopes for the program. It has to save lives. At some point this has got to turn around, she said. Domestic and family violence is a massive problem and we don't seem to be getting anywhere with it. Belconnen Community Services runs an early intervention program to support families and children. Its chief executive Deirdre Horn said she was hopeful the hub would work on the ground, but was realistic about the challenges still ahead. The whole of the reform still needs to happen, and this is just one of the many challenges, but we've got to give it a go because other things haven't worked, she said. Print, email, Facebook, Twitter. More.